Hi, I'm Dr. Sylvestre with Focus and Flourish. Welcome to the third video in our mini-series on the cryptorchid patient. My goal with this video is to ensure that when you are looking for a testicle and you don't have any idea where it is, that you will find it quickly, easily, and it won't be a hunt. It will be a follow the trail type of surgery. Of all the videos in the series, I think this one might be the most helpful. The testicle begins from just behind the kidney, and it's going to be pulled towards the scrotum by the gubernaculum. The gubernaculum will pull it along the dorsum of the abdominal cavity through the inguinal ring and eventually into the scrotum. So on the outside of the abdomen, you can appreciate the testicle is going to go from the inguinal ring and it's going to follow that spermatic fascia or vaginal tunic directly into the scrotum. We often refer to the dorsal part of the abdominal cavity as the gutter. When you are doing a ventral approach to the abdomen, that is the deepest part of the abdominal cavity and on either side of the spinal column. Within the gutters, you'll find the kidneys, adrenal glands, the reproductive organs, the ureters, as well as some blood vessels. Besides having all those organs, what makes the gutter a little bit special is that it's difficult to access because all the guts and the other organs within the abdominal cavity keep on falling back into that area. So it's always a struggle to keep the organs out of your way so you can see deep into the gutter. So how do we use this information as a surgeon? When you want to go look for an abdominal testicle, you know that odds are it got stuck at the inguinal ring. The rest of the path should be more or less open and pretty free. You need to go look for that testicle in the very dorsum of the abdomen, close to the ring. So at surgery, you're going to need to move the bladder away from the side in which the testicle, the retained testicle is, and go deep between bladder, inguinal ring. That's where that testicle should be found. The approach to find an abdominally retained testicle should be a parapreputial or paramedian approach. I am quite partial to the parapreputial approach. There has been a study published showing fewer complications with this approach when going in looking for a retained testicle. Go to my YouTube channel to see videos on the pros and cons of the paramedian versus the parapreputial approach, as well as how to do a parapreputial approach and how to close it, because that part is equally important. So you thought the testicle was in the abdomen, but you're not finding it. Before you decide to close the abdomen and explore the inguinal area, you must confirm that the testicle is not in the abdomen. The easiest way to do this is to go find the Ductus deferens and to follow it to the testicle or to the inguinal ring. If you see it going out the inguinal ring, well, then you have your answer. You need to go and explore the inguinal area. How do you find the Ductus deferens? You're going to grab the bladder and retroflex it dorsally. With that exposure, you will see the Ductus deferens, both of them, coming from the prostate. You won't see the prostate, but you'll see them coming from the pelvic canal, just sitting between the rectum and the urethra, and curving over the ureters, over the lateral ligaments of the bladder, and they should be heading towards the inguinal ring from there. So make sure you follow the Ductus deferens, not into the pelvic canal, but out laterally towards the inguinal rings. By tugging on them, you will either pull the testicle so that you can see it, or you will go look and see that Ductus deferens exiting through the body wall, exiting through the inguinal ring. All right, you've just seen that Ductus deferens go right out the inguinal ring. The testicle is not in the abdomen. Do not close the abdomen yet. Use that approach to your advantage to help you find the testicle within the inguinal ring. You may wish to extend your incision, your paraprepucial or paramedian incision. What you can do to help you with this is you can put a hand in the abdomen and push on that inguinal ring itself, and that will give you something on the outside to feel for, to palpate, and then you know that that's where the inguinal ring is. Make your incision go over that inguinal ring. Don't just put it anywhere in the inguinal area. Get it to go over the inguinal ring. You know the testicle went from the ring or was planning on going from the ring to the scrotum, so you need to be on that pathway. The other thing you can do is, especially once you've got your inguinal incision made, or you can appreciate that, is you can tug on the Ductus deferens from within the abdomen and see if you can pull that testicle right back to the inguinal ring on the outside of the abdominal wall. That helps to just put that testicle right close to where you're working already, and you don't have to look for it so much. You may be able to pull the testicle back into the abdomen through the inguinal ring. I personally have never been able to do that, but I try every time. At least being able to pull on that testicle and move that testicle will help you to find it within the inguinal area. Now that you know for sure that the testicle's in the inguinal area, you may want to palpate a lot more carefully and close to that inguinal ring. I find the testicles that are more difficult to find inguinally are the ones that are still maybe partially in the inguinal canal, very close to the inguinal ring. They are deeper and covered with more fat and more difficult to palpate. Let's get a better visual of this inguinal canal and inguinal ring from the abdomen to the extra abdominal side. Within my pictures here, I've inserted an instrument in through the ring. Now, if we look on the other side of the abdominal wall, you can see that marker within the inguinal canal or exiting the inguinal canal, and it's within that spermatic fascia, vaginal tunic layer in which the testicle should have found its path. When I remove that marker and enhance the dissection a little bit, you can see the entire spermatic cord, that tubular structure that the testicle would have descended through to get to the scrotum. The testicle will be somewhere in there. It won't just be anywhere. It will be somewhere in there. A couple more points to make. The large pudendal vessels exit the abdomen through the inguinal ring. So do be cautious when you are dissecting in that area. There's also the inguinal lymph node in that area, and it may be easy to mistaken it on palpation for a misshapen testicle. If the testicle that you retrieve from an inguinal approach is misshapen, abnormal looking, you may want to send it out for histopathology just to make sure you did, in fact, get the appropriate organ. The other point I'd like to make is this. Some surgeons will suggest that you enlarge the inguinal ring to help pull the testicle out, especially if you're in the abdomen and you want to get it back into the abdomen. I personally don't recommend doing that. I don't like messing with the size of the inguinal ring. If you do enlarge it, if you do open it up, you are going to want to make sure that you partially close it again to prevent an inguinal hernia from occurring. Be careful when you close it because, as I just said, there's that large pudendal vessel that goes through this inguinal ring. You want to make sure that you don't close the inguinal ring so much that you obstruct the blood flow in that vessel, and you definitely don't want to be suturing through that blood vessel. So my opinion is find another way rather than enlarging the inguinal ring in order to get the testicle out. If you have to, do that, or if you do end up doing that, then just be aware when you close it, be careful. That's all you need to do. Just be careful. I hope you found this video helpful. Please hit the like button and subscribe to our channel.